When you check your breasts, do you know what you're actually looking for? Most women look for a lump, but there are many other breast changes that can be signs of cancer. And unfortunately, these are the ones that many women aren't aware of. Welcome back to The Health Perspective. I'm Dr. Daniel Gordon, and today I'm joined by Dr. 𝗕𝗏𝗀𝗧. Liz is a former breast surgeon who has had breast cancer 3 times. She's a fierce advocate for breast cancer awareness and evidence-based medical information, sharing her incredibly personal journey through her books and incredibly popular YouTube videos. Liz also happens to be one of the first senior doctors I trained with when I was a junior, so many years ago. She was the one we all wanted to be on shift with, kind, approachable, and always willing to explain. Today, Liz and I are going to walk through the breast changes worth knowing about, what each one might mean, and when you might need to worry. Liz, it's good to see you again.
You too. You're going to make me blush. That was a long time ago, wasn't it?
It was a very, very long time ago. And just before we started, we were discussing how hard we worked, but how much we enjoyed that time.
It was a lot of fun. There was a lot of camaraderie in those days, yeah.
And I followed your journey actually quite closely, although I never reached out. And I know that it's been a challenging 3 years and a few years, and you've channeled that into this amazing advocacy you do now.
Yeah.
And just tell me a bit about why.
I guess I was a consultant breast surgeon. I was 40. I never checked my breasts. I found a lump. I thought it was just another breast cyst. My mammogram was normal, and 2 weeks later I was having chemo. And I was off for 1.5 years, and I was bored. And I had no life outside of surgery because it's all I'd done. And I started blogging and I started talking and discovered there were other ways to help people. And then when my cancer came back the first time locally in 2018, I couldn't work anymore. My shoulder didn't work properly. I couldn't operate. And I was unemployed. I was retired. I have no purpose in life. And I kind of started playing with videos and realizing I could reach people all over the world and help educate them and debunk some of the myths and show them what to do. And it's kind of given me a new purpose.
And I think that's when I started watching your videos, what I loved was it was the same Liz that was the surgeon, as in the way that you just talked to us when we were nervous juniors and we didn't know what we were doing. It was exactly the same. You were the same way that you were reaching out.
Yeah.
And that's clearly why you've grown such an amazing kind of follower base.
Because I've been on both sides. I mean, I've shared so much of my life. Mum said I shared far too much, but I know I get what my viewers are going through.
Yeah.
They know that I'm not making it up, that they can kind of empathise with me, and I tell it like it is. There's no BS, and I think that's really important.
Yes, I agree. And especially nowadays when there's so much online, I think there are a lot of doctors doing similar work, but unfortunately there's a lot of BS.
There
online.
are, and completely fake AI doctors on YouTube with millions and millions of views. It is scary.
It is. And I'm not going to go through your journey in detail because I think that there is so much on your channel about that. And I really would encourage anyone watching this to go straight to your channel and subscribe because it's brilliant.
Thank you. But this is not about me. It's about the people watching. It's about you out there.
Watching. And so what I want to do, and specifically what I love about this channel, is that it directly affects my patients and they come in and they say they've learned something from it. So what I'd like to do today is to talk about breast cancer symptoms and when to worry and what you're looking for.
So the first thing to say is that breast cancer doesn't make you feel ill. Most other cancers of the body, lung and bowel, they give you symptoms. The cough or the weight loss or the bleeding in the poo. Most people feel completely fit and well when they're diagnosed with breast cancer. And it can be hard to get it into your head. I was cycling up mountains in Italy the week before I was diagnosed. How can that be real? Most people don't check their breasts, men and women. They may do it in October or when a celebrity gets it, but that's it. And we think it's all about a lump, but it's not.
Is every lump cancer? When do you need to worry? What other causes of breast lumps are there?
So the main causes of breast lumps depend on how old you are. They're common in women in their 20s, and those are often things called fibroadenomas or breast mice. And they're like little lumps of breast tissue that have just formed, and they're like a little marble in the breast, and you can often move them around. Completely harmless. We leave them alone unless they're starting to grow. They don't become cancer. But women in their 20s and 30s are starting to get breast cancer. It is on the rise when you're young. And a lot of GPs and practice nurses still don't realise that women in their 20s and 30s can get breast cancer, and they might fob you off. So if you have a lump, ideally your GP should say, I'm going to send you to the breast clinic just to make sure it's not cancer. And if your GP isn't doing that for you, you can say, can you prove it's not cancer? No, I want to get checked out. Some women have to be that strong. It's really, really important. It's common to get lumps in your 30s and 40s, and these are when your hormone levels are starting to change. And the common lumps there are breast cysts. And there's lots of fluid inside your milk ducts, and little cysts can form, especially with the time of the month. And it can feel like a balloon, a tender, painful, tense balloon that you can kind of squish. It feels tense. They often get sore when you're about to have a period, and then they disappear when your hormones drop. Some cysts are permanent and they need to come to the clinic, and I love doing it. We just pop a needle in and drain them. Completely harmless. But again, you can get breast cancer in your 30s and 40s. I thought my lump was a cyst. I was 40. Turns out it wasn't. Generally, a lump in someone over the age of 45 or 50 we think is probably a cancer, and we rule that out first, but you can still get harmless lumps and bumps. Most harmless lumps feel round and smooth. Cancerous lumps tend to feel a bit knobbly, and they don't have discrete round edges.
And as a GP, I think I would always take the most risk-averse approach. So even if I thought something was a fibroid adenoma or a cyst, I would always refer on. And in fact, I worked in a very large GP organisation, a private organisation many years ago, where their rule was if a woman is worried about their breast, even if you can't feel anything on examination, you should still refer them.
Exactly. The 95% of women we see in breast clinic don't have breast cancer.
Yeah.
We see 16-year-olds with 1 day of breast pain to people with itchy nipples for 5 years. Most do not have breast cancer. But I can't tell with my hands. I'm an expert. I didn't know I had cancer. We need imaging to help. And that's why anyone with any symptoms should be sent up. Most of you won't have anything. But if you are being sent up, try and take a friend with you, because it's horrible waiting and you're imagining the worst. And that can just really help ease the tension.
Okay. So lumps are the one that we know about.
Yeah.
Breast pain.
Yes. So most breast pain is not a symptom of breast cancer. It is very, very rare for someone to just have breast pain and no other symptoms on imaging and have cancer. Breast pain can be associated with a lump or another change in the breast, and that may mean there's cancer, but by itself, it's not. And there are 2 common causes. One is that bilateral breast pain, which I describe as don't come near me or I will kick you, that you often get before your period when your breasts are growing, and again in your 40s and 50s near the menopause. The other common cause of breast pain is one-sided, and it's often felt around the bottom and the side of the breast, and that's actually muscular, coming from the nerves that supply the muscles in your back, neck and shoulders. And actually, women are more painful when you press on the rib cage, not on the breast. It just happens, it goes away by itself. But again, if you've had pain on one side that's not going away after a couple of months, get it checked out just in case.
That's very clear. I love the clarity. What about nipple inversion and nipple changes?
So nipple inversion means when your nipple points in, and some people naturally have both nipples in, one nipple, one out, and they normally come in and out as you're cold or you're sexually aroused, and that's completely normal. But if a nipple has suddenly gone in and you can't pull it out, you can't push it out with your fingers, there could be a little cancer behind the nipple pulling it back into the breast. So that needs to get checked out.
The unifying theme so far, which I'm sure is going to be threaded throughout this, is basically changes. So changes from normal, because breasts come in all shapes, all sizes, but this is about when something does not look like it used to look.
Exactly. And that's why it's so important to check your breasts every month so you know what's normal. They're sisters, not twins. They're not symmetrical. If you do it once a year, you won't know. Has my nipple suddenly changed? Did it look like that last year?
What's the evidence behind women self-examining, actually picking things up? How good is it? I think a lot of women worry that they just are not going to be good enough.
Yeah, I think we're not told how to do it. My mum didn't tell me. I wasn't taught at school. I only know because I'm a breast surgeon. Mm-hmm. A lot of videos you see online are actually telling you to do the wrong thing.
Okay.
If your breasts are large, you can hold a pencil underneath them. What you see online won't show it. That's why I've got videos showing people. They're scared of what they might find. They're scared of doing it wrong. And I think it's just showing people how to do it properly. Your hands are the best thing you have at recognising tests. Mammogram screenings are great to try and pick up things beforehand, but often it is your hands, and they do pick up an awful lot of lumps, not just in the breast, but enlarged lymph nodes in the armpit could be a sign of breast cancer as well. I can't recall studies to hand to show because most women don't do it.
Yeah. And how can I as a GP be better at helping women, my female patients, to do it more often?
I think digitally signposting them to a great video or a website that tells them how to do it properly. This is what you need to do. Watch this. And I think you tell them breast cancer is on the rise and is happening to more and more women. And the earlier you find it, the better your chance of survival, the better your chance of a cure, the less treatment you'll need. And I know you'll go away and do it once and never do it again. But the charity 𝗕𝗵𝗴𝗀𝘀 will send you a text to remind you on the 1st of every month. I tell women just to put it in their phone.
Oh, that's great. I didn't know that.
Ideally, if you're still bleeding, having periods, you should check mid-cycle when your boobs are less lumpy. But most women check on the first of the month. And I think it should be general. Check your breasts, check your genitalia, check your pee, check your poo, check your mouth. Just a general red flag signs. Once a month, it's done.
And you have an excellent video, don't you?
Yeah.
So we're going to put that in the comments.
Thanks.
Okay, so nipple inversion, nipple discharge. That's a very scary one.
It is.
And discharge comes in all colours and consistencies.
And I had it, and it grossed me out. I was in my mid-30s. I just started dating. I was in the shower, and this creamy, greeny nipple discharge came out. That's disgusting. And you keep pressing, and it keeps coming. Oh, my God, that's horrible. What's my husband going to think? Completely normal.
Okay.
It's a bit like snot. So the nipple has ducts which take milk to a baby if you're pregnant, breastfeeding. And when the ducts aren't being used, they have secretions in them, just like your nose does. And the bacteria in the air change the colour of the secretions. Like your snot can be white or green or brown, so can nipple discharge. Completely normal, common in your 30s and 40s. Don't squeeze, because it just keeps stimulating it. You empty the ducts, they fill again. Leave it alone, it will settle down.
Okay.
But if it's crystal clear, like water, that could be a little papilloma, a little harmless cancer, not a cancer, a benign tumour that might need to be removed. If it's blood-stained, that could be a sign of a small cancer in the nipple duct. And women may only notice that if you sleep in your pyjamas or your nightie and you see blood stain on your nightwear or in your bra, that needs to get checked out.
I usually have so many follow-up questions, but you're so clear in the 2 minutes that you talk that I'm like, okay, that was very clear. I'll move on.
If it's crystal clear or it's bloody, you need to get it checked out. If it's anything else, you may think it's gross and disgusting. Leave it alone. It will settle down.
Amazing. Even if it goes on and on, or if it's kind of, okay.
It's more common in smokers because what smoking does is damage the little hairs. So that's why you get a smoker's cough, because you don't have the cilia, the name for the hairs.
Yeah.
So that can mean that your ducts are more likely to keep filling up with fluid. So stopping smoking can help.
Okay. So let's talk about skin changes now.
Yes.
And there's so many. So there's dimpling, puckering, there's
Yeah.
orange skin, which is
Yeah.
a term we taught in medical school. And obviously that's trickier.
Yeah.
Because I think, we think of, as GPs, I guess we see so many rashes and rashes under the breast and fungal infections and everything. So
should we start with rashes?
let's start with rashes.
So first of all, there's a rash around the nipple. So nipple eczema is really, really common. Often it can be a reaction to a change in your washing powder. And the first treatment should be a simple steroid cream. But if it's not settling, it could be something called Paget's disease, which is a precancer of the nipple. So if you have a nipple that's itchy, just one side, a cream isn't working, go back and say, I need to be referred. And we just do a little punch biopsy, take a couple of millimetres of that skin to see, is this just really bad eczema or is it a cancer of the nipple?
And who does that affect, Paget's disease?
It's more common in women in their 40s and 50s and 60s. And because that's when the DCIS is more common. And often what can happen is the rash starts to eat away at the nipple like an ulcer if it's left alone.
Okay.
So if it's not settling and you've had a cream or two, go back and ask to be referred. The next is a rash in the breast that can make it change colour and look red if you have Caucasian skin. If you don't have Caucasian skin, it's really hard to see. The breast might look dark brown or purple in colour, and we are getting better at getting images that are fully representative of everybody's skin. Now, this is common in women in their 20s and 30s and 40s when they are pregnant, when they are lactating. Mastitis, inflammation of the breast during pregnancy. And the breast can feel red and hot and warm and painful. And the first treatment should be a good course of antibiotics because it probably is mastitis. But if the antibiotics don't work, you send that woman to a breast clinic quickly, because that can be a sign of breast cancer, particularly something called inflammatory breast cancer. And that's cancer in the lymph glands, in the lymph vessels in the skin of the breast tissue. And it can be quite aggressive. And a lot of people ignore it. Midwives don't know it's a cancer. They just keep giving antibiotics and antibiotics. So mastitis hasn't settled down within a week or two. Get yourself to the breast clinic. Demand it. You need to be seen to make sure it's not a cancer. If we see that in an older woman in their 40s, 50s and 60s, it would be unusual, or older, it would be unusual for them to get mastitis because they're not pregnant or breastfeeding. So that should be clinic first, not antibiotics.
Fantastic. And then what about dimpling changes?
Yeah, so this is often one of the first signs of breast cancer, and that's why we get you to strip off and look in the mirror. And we get you to look with your hands by your side, and then you put your hands above your head, and then you put your hands on your hips and you push in. And what that is doing is your breast is connected to your chest wall by strands of fibrous tissue. And if there's a cancer there, what it does is it can bring those strands in. And you only see that when the muscles are tensed. So by lifting your arm up or putting your hand on your hips, you're tensing the muscles behind the breast and you can see a dimple. And it just looks like a little puckering of the breast. And it may be at the side, it may be underneath. And that could be the earliest sign of a lump. It's particularly common in a type of breast cancer called lobular. So most breast cancers come from the ducts that take milk to the nipple, but I had a mixture. I had lobular cancer, and that's like the meat of the breast that produces the milk. And lobular is sneaky because it doesn't form a lump, it grows in sheets. And it's often a diffuse mass in the breast that can cause that dimpling, but no discrete lump. And that's why looking in the mirror could be a very early sign, and that needs to get checked out.
Okay. And is that what we taught when we're taught in med school about peau d'orange or
No.
orange skin? So tell me about that.
So peau d'orange is kind of French for orange skin. We used to call it cellulite. This is a sign of inflammatory cancer again, the inflammation of the lymph vessels in the skin, but without the redness. So what it does is those lymph vessels are blocked. So you kind of get fluid building up between the little ducts on the skin, and that's why you get that puckering. And that means that there's a cancer inside the skin of the breast, and it's quite a late stage of inflammatory cancer. So if your breast looks like an orange peel or cellulite, you need to be sent to a clinic.
Okay. What about armpit changes?
Yes. Well, also, I should say your breast can change in shape and size.
Oh, yes.
Your breast can get bigger or it can get smaller depending on the cancer in the breast and what's happening to it. So again, if your breast is changing size and staying, that needs to be checked.
And what about symmetry as well? Because I think
And symmetry, yeah. So most of us aren't asymmetrical. It's normal for a nipple to be 5 centimetres lower than the other if you have large breasts. They're sisters, not twins. But if you've suddenly noticed that your bra isn't fitting normally,
I love those
get
sisters,
checked
not
out.
twins. I've never
I
heard
got that from
before.
𝗕𝗵_µneil at the Marsden. Fiona McNeil at the Marsden. It's brilliant.
That's brilliant.
So armpits. So most doctors find it really hard to feel lymph nodes in the armpit, and I'm terrible. And I can't feel them, and then my radiographer says their armpit's full of nodes. And I couldn't find them. It's really hard. But there are women who will find a lump in their armpit, and that's their only sign of breast cancer. And I know a couple of young women in their 30s who found a lump in their armpit. And it took 3 or 4 months of convincing someone to send them to the breast clinic and a variety of scans until they finally see a tiny cancer in the breast. Sometimes it presents there first. And that's why it's really important to check your armpits. And most of the videos online say, put your hands in the air and feel by your forearm. But that's not your armpit, that's the back of your arm. Your lymph nodes are where breast cancer drains to first. Doesn't mean it's spread all over the body, doesn't mean it's incurable, it's just part of the breast if you have them. And they live up above the hairline, up above where you'd shave. So you need to get your hand in there, and it's like squishing your hand against your rib cage, trying to feel a marble. Lymph nodes can be about 1 centimetre in diameter normally, but if you can feel like a big chickpea or a bean, and what I tell women to do is just to rest one hand on their shoulder, let the arm go nice and floppy, and you get your hand right up in the armpit, and you just have a guddle around. You may feel something. If you do, you need to think, is there a reason for having an infected gland? Have you had a recent cough or cold or felt unwell? If there's nothing for it, or a cold's gone away, go and see the GP to get it checked out.
And I should add that actually this is one of the commoner reasons that women are currently coming in.
Really?
But not because of cancer, but because actually armpit lumps are very common.
Yes, they are.
And especially if you shave.
Yes.
So the commonest armpit lumps we see, weekly might be a bit much, but probably once or twice a month,
Yeah.
are infected cysts
Yes.
from shaving. So those are often hot, red, sometimes
Yeah.
discharging. They came up quickly, they came up
Yeah.
after shaving. And often you do have to see the doctor about those.
Yeah.
But that is not likely
No.
to be cancer.
And this isn't something in the skin. If you've got something in the skin that you can feel that's red, that's sore, that's not lymph nodes. Lymph nodes are right deep
much
inside
deeper.
a fat pocket. So it's feeling something deep inside your armpit, like a lymph node, that's different. That needs to be seen.
So I think I've given you the GP list of everything.
Yes.
What have I missed?
So very rarely breast cysts can have cancer in them. You can get chronic cysts that just have some cancerous changes in the walls. And we get women who've had lots and lots of cysts and they feel a pain. I saw you 3 months ago. What's come back again? Please just keep going back just so we can ultrasound and check and make sure the cyst hasn't changed. And I think that's everything.
Yeah, and I was very torn when I was preparing for this about whether we talk about other signs of breast cancer, for
Yeah.
example, bone pain and so on.
Well, we should do.
Yeah, it's difficult because obviously these are late findings.
Yeah.
but
And also men as well.
yeah.
So men do get breast cancer. It is common. Well, no, it's not quite lie. Men do get breast cancer, about 1 in 300 men, compared to 1 in 8 women in their lifetime. And commonly it's mistaken as jogger's nipple, Men in their 40s who are out running and they see some bleeding from the nipple, they think it's just irritation from a gym shirt, but that could be breast cancer. And you can also, men can get breast cancer which just presents like a normal lump. So if it's important that men check as well.
Okay.
But 5 to 10% of women who are diagnosed with breast cancer have incurable stage 4 disease from the beginning.
That's petrifying.
It is. And that's because you only know you have stage 4 disease when it's big enough to cause symptoms. And that's why we say if you have back pain, hip pain that's worse at night and doesn't go away, you have a cough that doesn't go away, you have headaches and sickness in the morning, we need to make sure that's nothing scary. Not breast cancer, another cancer. These are the signs of it coming back. But the cancer can be there before it causes those symptoms. And some women will come along and we'll do some scans and imaging and we'll see that it's already spread.
Yeah.
And it's really scary if it happens to you. But the treatments are amazing. The number of things that have come out in the last 5 or 10 years to extend the life of people with stage 4 disease. But it's scary.
I've definitely seen that as a doctor. And this is not just about breast cancer, it's about other cancers.
Exactly.
Where I see someone in clinic and it's one of those consultations where you're immediately like really worried and you send them and they have some kind of disseminated cancer.
Yeah.
And then you expect you're probably not going to see them again. And then they're started on some immunotherapy that I've never heard of as a GP.
Something mad.
And 6 months later they walk in
Yeah.
and they're, everything's in remission.
Yeah.
I mean, they still have the cancer, but it's all being held back brilliantly by these new drugs. And it's really, really hopeful, I think.
There is a lot of hope out there. We've got people living with breast cancer for 15 years now. Incurable breast cancer. There's hope. There's talk of a cure in the future. But anyone listening, there are 50 different types of breast cancer. You've got 13 different cells, and then you've got the combinations of all the different receptors, so you can't compare your cancer to your mum's or your friend's. If you have it, it's all completely unique.
So let me finish with a broader question, which is how can you remain breast aware and examine appropriately without letting anxiety take over? Like how do you do, I guess listening to your story it's triggering and it's challenging.
Very.
So how do we draw the line between sensible and not being consumed by it?
I think if you're someone who isn't very worried about their health, they don't have chronic health issues, they're normal, then just think of it as a sensible thing to do. You clean your teeth, you check your breasts, you check your pee. That's it, you move on. It's just something that you do. And if I find it better, yes, it's scary, but I have a better chance. If you are someone who is worried about your health, it can be really, really triggering. And then you're checking your breasts every day and then you find something and then it's really sore and then you make it up. And that can be really, really hard. And that may be something to talk about with your GP, about controlling the health anxiety and how can you get on top of it. Yeah. You may not want to check because you're terrified of finding something. And a lot of people feel like that. Women aren't going for their mammograms because they're scared of what they might find. Yeah. So I think if you're worried, go and see the GP and talk to them about it. What can you do? CBT therapy, counselling to help. But try and see it as just monthly maintenance.
Yeah, I agree. And I think actually there are some people who just go to the GP for a routine breast exam. Yeah. And I think if you don't feel confident doing it, so if you feel that it's going to lead to a whole deluge of fear and anxiety, then just go and outsource it to a professional.
You might be scared of checking yourself. You might want someone else to do it to do it properly. That's completely fine. And if it is you, try and get that done at least once a year. Because most women don't do it themselves. Like we don't check our pee, we don't check our poo. This is what I learned. I never check my poo. And the late Deborah James was diagnosed with bowel cancer in her 30s because she had blood in her poo and left it alone for 6 months. When you flush the toilet, there's a 6-foot spray of microorganisms that goes up into the air. And most of us have our toothbrush and our towel and our soap right by the toilet. So you look and then you shut the lid and then you flush.
Wow.
Yeah.
What a closing thought. I'm going to go rearrange my bathroom now.
Or just close the lid.
Just close the lid. Liz, it's been as usual. Whenever I speak to someone on YouTube, I learn so much. And I thought I knew it all from med school, but I don't. And I'm really grateful to you. And we're going to be doing a few more videos as well.
Yeah.
Thank you very much.
You are welcome.